Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your question on injuries, training, rehab, or technique. We'll be taking your phone call shortly. Call 856-767-8884 or toll free 888-634-7488 for your direct line to Sports Doctor. Now here's your medical reporter for tonight's show, Joe Chapana.
And a very pleasant good evening to you, wherever you may be. My name is Mark Fontez. Joe Chapana will be with you next week. We welcome you to another edition of Sports Doctor here on WPSJ. And of course, this show is brought to you every week, courtesy of our friends at the Rothman Institute. Put your trust in Rothman. Tonight, joining us is Dr. Nick Tawil, who is a past guest of this show. He's also our guest tonight. He's an expert in podiatric medicine and orthopedic physical therapy. Dr. Tawil, I know you've come all the way from Philadelphia. Thank you for joining us. Yeah. His interests, Dr. Tawil's, include rehabilitation of the foot and ankle, as well as sports medicine, fracture care, diabetic foot care, and a whole slew of other things. He is board certified and recertified by the American Board of Podiatric Orthopedics and Primary Podiatric Medicine. He's also an orthopedic certified specialist by the American Board of Physical Therapy Specialties. Dr. Tawil lectures extensively. He is also published. He's appeared in books. He holds active faculty appointments at Columbia, Arcadia, Drexel, and Widener universities, and he sees patients at the Rothman Institute's Center City, Northeast, King of Prussia offices, as well as the Nova Care Center in South Philly. Doctor, we'll start off with, I know that people have a lot of questions about the feet, and of course it's a commonly injured part of the body in sports. We always hear, you know, I sprained my ankle. That happens in soccer, it happens in football. What really happens during an ankle sprain?
Sure. That's a good question. An ankle sprain is an injury to a ligament, and a ligament is the structure that holds the bones together, holds the joints together. Now, with ankle sprains, the most common area sprained is the lateral ligament, and it's actually a group of 3 ligaments, and the mechanism that causes this type of sprain is the inversion mechanism, and some folks call it they rolled their ankle. And that accounts for about 85% of all ankle sprains. Now, another interesting variety is the high ankle sprain that you may hear of. And there's a ligament called the syndesmosis, or the syndesmotic ligament, that holds the ankle socket together. And this is a common sports injury with linemen, where the foot's planted and the foot rotates. And what that does is put a lot of tension on the syndesmotic ligament right here, and you get what's called the high ankle sprain. And the last variety is the least common, and that's the medial ankle sprain, because you have a very strong ligament on the inside of the ankle, and that accounts for less than 5% of the sprains.
Fantastic. And in case you're just joining us and your curiosity's been aroused by this, we encourage you to call in. The phone lines are open. The number, if you're local or if you're in South Jersey, 856-767-8884. Toll free, you can reach us at 888-634-7488. Our guest again, Dr. Nick Tawil, certified podiatrist. We're talking about the ankle. Why, I mean, you've explained what a sprained ankle is, what happens during it. Why is an ankle injury so important to correct as soon as someone possibly can?
Well, the biggest concern that you have with an ankle sprain is the stability of the ankle socket. There's an inner ankle bone called the talus, and that's held in place by the medial and lateral malleolus, as you see here. And with an ankle injury, in some of them, there's widening of this ankle socket, or there's a looseness of the ankle socket as an individual walks and runs. And what that can do over a long period of time is cause some breakdown in the ankle itself, much like if you have a loose tire on your car and you drive for many miles, that tire can break down prematurely. So it's very important to be treated promptly for this so you don't have instability.
Great. I understand we have our first caller of the evening. She is Abby. She's out in Aston, Pennsylvania. Abby, welcome.
Yeah.
What's your question tonight for Dr. Tawil?
My question is in regards to plantar fasciitis. I am an active athlete. I play ice hockey, and I was pregnant last year, and now I've developed a lot of pain in my foot, especially after sitting for a little while, and I get up and I start walking.
Sounds like it's been a problem for her for some time. What would you say to that?
Well, that does sound like plantar fasciitis. symptom of what we call first step pain, where you have heel pain when you first get up in the morning or after you sit for a prolonged period of time. That's almost a hallmark sign of plantar fasciitis. But let me first define what plantar fasciitis is. At the bottom of the foot that sits at the base of the arch is a very strong ligament. And when the arch depresses, the ligament is stretched. It's called the plantar fascia. And if it stretches excessively, then you can have microscopic tears at the attachment point, and that can cause inflammation and pain. The treatment for plantar fasciitis is initially twofold. One is to improve the flexibility of the calf muscle, because when the calf muscle is tight, it puts more downward pressure on the arch, which then in turn stretches the plantar fascia. And the second first line of treatment would be arch support, whether that's use of an orthotic or an off-the-shelf arch support and a proper show.
Gotcha. Again, if you do have a question for Dr. Tawil here on Sports Doctor, the number 856-767-8884. You can also reach us toll-free at 888-634-7488. We're here with Dr. Nick Tawil, a podiatrist. I guess we'll ask again, what is Achilles tendonitis, if you haven't already talked about it?
Well, a tendon is the structure that attaches the muscle itself to the bone. And the Achilles tendon attaches the calf muscle to the heel bone. Okay? And this model shows part of the Achilles tendon. Now, with calf tightness and overuse, one can develop inflammation of the tendon and microscopic tears. And early on with tendonitis, there's inflammation of the covering of the tendon, but if the tendonitis goes untreated and progresses, the actual core of the tendon, the inside of the tendon, can become scarred down, and that's called tendinosis. And that becomes a chronic condition that predisposes an individual to a rupture.
Yeah. How would you treat a person who has Achilles tendonitis?
Yeah. Well, first and foremost, you have to increase the flexibility of the calf muscle. Depending upon the symptoms, some patients will come in limping and say, I limp with every step and I have pain. Those patients need to be immobilized in a cast or a specialized boot called an Achilles tendon boot that we use at the Rothman Institute. Some patients, however, just have pain when they run or when they play sports, but their normal activities of daily living are really not that affected. Those people can be managed with a stretching program, physical therapy, heel lifts, and sometimes anti-inflammatory medication.
Mm-hmm. Can Achilles tendonitis, if not treated, can it turn into a ruptured Achilles tendon?
Absolutely. Like I alluded to earlier, if it goes untreated, the core of the tendon, the inside of the tendon, can become scarred down and what we call fibrotic, and then it's weakened. With patients, I liken it to a tree. Achilles tendonitis is like a tree. Early on, it's just the bark of the tree that's inflamed. Well, if a tree has diseased bark, it's still strong. Wind's not going to blow it over. But if the trunk of the tree becomes diseased, then it's weakened. Same thing with the Achilles tendon. So it's the center that becomes weakened, and that predisposes someone to a rupture.
This is Sports Doctor. In case you're just joining us here on WPSJ, we are taking phone calls at this time. The toll-free number 888-634-7488. Our guest, Dr. Nick Tawil. We've been discussing ankle problems as well as tendonitis, should it ever happen, and it does to a lot of people. What would you say, Doctor, are some of the most common foot and ankle problems that you encounter in your practice?
Sure. Well, the Rothman Institute is a tertiary orthopedic practice, so we see the entire spectrum of musculoskeletal problems, from minor problems such as plantar fasciitis and ankle sprains to significant fractures, significant sprains, tendon ruptures, diabetic foot problems, and the like. Off the top of my head, the most common things that I see in my practice: plantar fasciitis, Achilles tendonitis, ankle fractures, metatarsal fractures.
Great. We're going to go back to the phone lines. Looks like we have Wendy in Philadelphia. Wendy, thanks for calling Sports Doctor.
My feet hurt all the time. I have a ligament that runs down the center of my foot, actually both of them, that's real tight. You can actually feel how tight it is, and that just hurts constantly. Sometimes I can't lift my toes. It hurts so much. But I was listening to what you were saying earlier about it being connected with the calf. Is it possible that the pain I'm getting kind of like behind my calf could be connected to the foot problem?
Absolutely. It's no surprise when patients come in that have what we call plantar foot pain at the bottom of the foot, that's associated with the plantar fascia or the muscles of the leg, that they also have calf tightness. And if you have calf tightness, you can have pain in the calf, pain in the Achilles tendon. So a lot of these things coexist. For your problem, it sounds like you have an issue with the plantar fascia. You're talking about a ligament that runs down the center of the foot. If it's on the bottom of the foot, it's probably the plantar fascia like we talked about. So I would focus on flexing the calf and getting better flexibility and wearing good shoes and possibly arch support.
Thanks, Wendy, for the call. We're going to stay in Pennsylvania. We're going to head over to Chester. Is it Townsend? Townsend, you're on Sports Doctor. Go ahead.
Yes, I'm calling about a torn tendon in the right foot. And it happened, believe it or not, in 06. And I didn't find out about it until late 07. And then that causes my calf to hurt and a torn hamstring all on the right side. Now, to say I'm taking physical therapy, but as soon as they finish with the therapy, 5 or 6 minutes right after, my muscles tighten right back up again.
Well, specifically, do you know which tendon was torn?
Well, you got starts with a P, I think.
Posterior tibial tendon?
It's the main tendon that goes across the top of the foot.
Okay. If it starts with a P, it's probably the posterior tibial tendon. That's the tendon that essentially holds up the arch. And we see chronic tears with that in people that have excessive pronation or excessive flattening of the feet. Basically, the first step would be to look at it closer with an MRI to see how significant the tear is, and then the treatment would be based on that. Conservatively, if it's your posterior tibial tendon, you're looking at either a foot orthotics if it's not severe. If it is severe, you're looking at some sort of ankle brace, customized ankle brace, and certainly surgery is an option if ankle bracing isn't to your liking. So the first step I would do is to look at it closer with an MRI.
Thanks very much, Townsend. We're going to take a quick break, actually, but we'll come back to Tanya in Wilmington, Delaware. You're watching Sports Doctor here on WPSJ. Sports Doctor is brought to you by the Rothman Institute with 8 locations around the Delaware Valley. You've got Media, Pennsylvania, 3 Philadelphia locations, Center City, Northeast, and South Philly. Also King of Prussia, PA, on this side of the river, Voorhees, New Jersey, as well as Egg Harbor Township and Manahawkin, New Jersey. To contact the Rothman Institute, contact them toll-free, 888-660-3232. You can also check them out online at rothmaninstitute.com. We'll be right back with Sports Doctor. Stick around.
The Rothman Institute and its world-renowned physicians work closely with registered dietitians. Our plan can help prevent diabetes, lower blood pressure, and build lean muscle. Through this relationship, Rothman's wellness program ensures orthopedic well-being, incorporating pharmaceutical-grade supplements as well as a lifestyle plan to optimize your overall health. Call our wellness team today, 888-777-3077, the Rothman Institute.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Crosskeys Physical Therapy, one of the leading rehab centers in South Jersey.
Crosskeys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Crosskeys Physical Therapy.
We welcome you back to Sports Doctor here on WPSJ. I'm Mark Fontez. Joe Chapana is off tonight. However, he will be back with you next week. We are so glad to have the distinguished podiatrist Dr. Nick Tawil with us. He comes to us, his practice is in Philadelphia, and he's been a guest of Sports Doctor before. We are going to head right back to the phone lines without further ado. Tanya in Wilmington, how are you tonight?
Hello.
Tanya, hi, you're on Sports Doctor. Go ahead.
Yes, I was calling because underneath the bottom of my foot, between the arch and the bottom, the back of the heel.
Are you still there, Tanya?
Yes, of the heel. It's excruciating pain, like where the bone, it sends like sciatic pain up to my knee.
Do you think you have a sense?
Yeah. Now, you have pain on the bottom of the heel? Is that what you're saying?
Yes, like between, I was going through therapy, and they had gave me like a night boot.
It sounds like another case of plantar fasciitis, since we have an epidemic of that tonight. A night splint is something that's worn for plantar fasciitis at night. As I alluded earlier, calf flexibility is important, and there's a device called a night splint, or sometimes it's called a plantar fascial night splint. And what it does is it basically holds the foot in a dorsiflexed position like this. So it puts a stretch throughout the calf muscle at night while the patient sleeps to avoid the first step pain in the morning.
Gotcha. Thank you very much, Tanya, for the call. We're going to head over to Cape May County. Bill, welcome to Sports Doctor. Go ahead with your question.
Hi, how you doing? I just had a quick question about tendonitis in my knee. Just give you a quick background. I had tore ACL in 2002, successful surgery, and back to a full schedule of running and doing whatever. But I notice now I'm getting tendonitis on a pretty regular basis. If I run maybe 2 days in a row on the heavy side, you know, I'm definitely feeling on the third day. Is there anything, any supplement, any type of, you know, I guess supplement I could be taking on a regular basis?
What would you
say?
Well,
for tendonitis, I'm assuming it's your patellar tendon, the tendon in the front of the knee?
Yes.
Well, in terms of supplements, the only supplement that I'm aware of that has anti-inflammatory action would be fish oil or omega-3 supplement. But beyond supplements, you need to improve flexibility of the muscle that's associated with the tendon, and then you need to alter your training and your running so as not to perpetuate the tendonitis.
Gotcha. Thanks very much for the call, Bill. And of course, if you have a call and if you're seeing this right now, our toll-free number 888-634-7488. Dr. Nick Tawil taking your questions about foot and ankle injuries. We're going to go back to Wilmington, Delaware. Don, thanks for calling Sports Doctor. Go ahead. Don.
I'm having problems, like I said, with the bottom of my heel with sharp pains and burning. Now, I've had the treatment of the electric shock, and it seems like that's not even helping at all. It's the same thing, the burning of the heel and the pain, like you said, first thing when you get up in the morning and all.
Okay. Yeah. Well, it still sounds like plantar fasciitis, but sometimes, since you brought up burning of the heel, sometimes there's a small nerve that runs underneath the heel bone. It's called Baxter's nerve, and sometimes it can cause a neuritis. Typically, patients that have this have pain at night, and they also have pain on the inside edge of the heel. So that's something to consider in the diagnosis if the pain is burning and you didn't respond to the typical treatments for plantar fasciitis. It still can be plantar fasciitis, but that's something that I would entertain is what's called Baxter's neuritis.
Your feet, of course, one of the most important parts of the body. It's what we're talking about in depth tonight. We do have another caller on the line in Philadelphia. Kim, thanks for calling Sports Doctor. You're on.
Hi, Nick. It's Kim McGroarty, and I'm calling about Kieran, who I'm sure you know very well. He actually broke the growth plate in his ankle in June, got his cast off after 6 weeks in July, and then re-broke it in August. And my question is it going to have any long-term effect on his growth?
Well, hello, Kim, and you have my phone number, so you don't have to call in to a show, but at any rate, there's a possibility. Now, with growth plate injuries, the growth plate is the part of the ankle, and this is an adult, but it's the part of the ankle where growth occurs, and it's made of cartilage. And the big concern is the alignment of the growth plate. Has it shifted? Is it compressed? Is it widened? What I would recommend for Kieran down the line is that he have sequential x-rays just to make sure that the growth is symmetrical, and it would be bilateral ankle x-rays for that, just to make sure that things are growing normally. Sometimes if part of the growth plate is delayed, the other part grows normally, and there can be an angular deformity. So sometimes that requires surgery. So Kim, you just got to, we'll have to keep an eye on it with bilateral X-rays. Probably, I would recommend every 3 to 4 months for the next year or so.
Thanks, Kim, for the call. Always nice to have a friendly conversation as well as a professional one at the same time. If you'd like to call in, again, the toll-free number 888-634-7488. Our next caller for Dr. Nick is also in Pennsylvania, Naomi. Hello, good evening.
Hi, good evening. I wanted to, my husband is always asking me to massage the bottom of his heel.
What would you say, is there a problem that he's talked about with it, or?
Yeah, it always bothers him. He could, when he walks on the front of his feet, and he doesn't like to lean on his heels because he says they hurt so much. I was just wondering, what do you think could be the cause of that?
Yeah, well, there are more than 30 causes of heel pain, and again, it's the common theme tonight. The most common is plantar fasciitis, but I think it would start with an examination. You know, other things that could be possibly happening. It could be a stress fracture. He can have a nerve entrapment, like we talked about. The pain could be coming from his back. So I think a good workup, starting from the beginning and moving forward, is the place to go.
Great. We have Anne-Marie from Oakland, New Jersey. We will get to you in just a moment, I promise. We do have to take another break. And of course, this is Sports Doctor on WPSJ, brought to you by our friends at the Rothman Institute with 8 locations throughout the Delaware Valley. Reminding you again where they are: Media, Pennsylvania, Center City, Northeast, and South Philly, King of Prussia, PA, Voorhees, New Jersey, Egg Harbor Township, and Manahawkin, New Jersey. To call them anytime, it's toll-free, 888-660-3232. You can also check them out on the World Wide Web at rothmaninstitute.com. You're watching Sports Doctor, and we'll be right back.
Some of the best athletes in the world play for the teams of Philadelphia. And when it comes to sports injuries, they put their trust in the #1 orthopedic care team in the Delaware Valley. The Rothman Institute. The best professional athletes trust Rothman. Shouldn't you?
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Crosskeys Physical Therapy, one of the leading rehab centers in South Jersey.
Crosskeys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Crosskeys Physical Therapy.
Welcome back to Sports Doctor. I'm Mark Fontez, your host for tonight. Joe Chapana is off tonight. He'll be back with you again next week, though. If you've been watching, we're joined by Dr. Nick Tawil, an experienced podiatrist. We're also taking your calls at 888-634-7488. Next up, Anne-Marie in Oakland, New Jersey. Thanks for calling.
Hey, thank you for taking my question. 9 years ago, I suffered a trimalar fracture, injuring and breaking not only my ankle area, but also my tib and fib. And right now, my tib bone just rests right on top of my foot. Is there any such thing as an ankle replacement, and would that benefit me?
Yes. Well, you had it sounds like you had a serious ankle fracture. The trimalar fracture is a fracture of the outside bone, the inside bone, and part of the bone in the back. And that makes for a very unstable ankle socket. And I talked about instability in the beginning, and this is probably the worst case you can have of it. When it's put back together, it does produce more stability.